Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Reform Advocacy, where we address problems in the healthcare system and take actions to try and make a better system for all of us. Before we go too far, let me point out that down below in the description area is a link to Healthcare Advocacy's newsletter for today, which has the text of this video. Every link I describe and every reference, they're all in there. So you just have to click on that newsletter, open it up, and it'll have hyperlinks to everything we're describing. Okay, it's November 1st today, and so it's the beginning of enrollment for those who need to purchase health insurance on their own via the Affordable Care Marketplace. Last year, that was about 16.3 million of us. There are also 10 million people who were on Medicaid last year who have been disenrolled from Medicaid in the so-called unwinding when the COVID-19 pandemic was declared over. So they're also going to be out there shopping for plans. In the newsletter, there's a link to the healthcare.gov federal site for the 32 states that use the Affordable Care Marketplace. There's also a link to a site that has links to each of the 18 other states' sites, because they're all separate, and to one for the District of Columbia. If you're in those areas, go use those. Okay, now changing insurers might mean a lower premium. There are also online calculators, and there's one included at healthcare.gov, and of course, that reference will be in the newsletter. This whole report was published originally by NPR, and there's of course a link to the NPR story as well. But I want to tell you, if we had universal health care, we wouldn't be having this discussion. I'm just saying. Okay, prior authorization hell. Recently, we did a story on claims denials and prior authorization denials. Insurance companies claim that they're making sure that treatments are covered by the insurance and that they are suitable for the patient. The most charitable thing I can say about that is that they're second guessing the doctor. The doctor has already decided what is suitable. The effect of the insurance company's behavior is that they hold on to funds longer, they keep them invested, and as long as they're invested, they're earning more money or more profits for the insurance companies. So instead of paying the claims or authorizing treatment, they just hold on to the money. And it's not a small number. Insurance companies are allowed to use clinical data to deny claims or treatments. They're not required, as far as I can tell, to disclose the source of that clinical data. And frequently, those denials cause discomfort, distrust, and death. So let's talk about some of these. Let me give you a real simple example to begin with. And it's fairly trivial. It's mine. I tore the meniscus in my knee. If you don't know what that is, that's cartilage under the kneecap. My orthopedist looked at it and he said, oh, I need to go in there and trim off the tear, and then you'll feel better in just a couple of weeks. He told me, go get an x-ray. I looked at him and I said, an x-ray is not going to show you anything in the cartilage. And he goes, I know that, but your outstanding insurance company demands an x-ray before an MRI, which is what I really need. They'll never approve the MRI unless they see that the x-ray failed. Somewhere that insurance company believes that that's a cheaper way to go. Have an x-ray instead of the MRI. Okay, well, I got my knee fixed and it works fine. However, I was limping around with a knee as big as a grapefruit for 3 additional weeks because they didn't approve the MRI right away. So somewhere that company's clinical data said that that was okay to do. Remember, when an insurance company stands between you and your doctor, the only one that suffers is you. Hold that thought. There are some tragic consequences. In the newsletter below, there's a YouTube link to several stories on the evils of pre-authorization, and I don't mean that lightly. In one of them, a doctor who's in the San Diego area requested a wheelchair for a patient who had no legs. The request was denied because the doctor did not describe how having no legs would inhibit mobility. Another story was about a patient who had a really aggressive form of cancer, and the doctor said, I need an MRI to confirm. By the time the MRI was finally improved, 5 weeks had elapsed, and her particularly aggressive cancer had spread so far that her leg needed to be amputated. Had the MRI been approved when requested, she would have had that leg. Okay, these are not just idle stories. This week, or within the last week, the Journal of the American Medical Association published a study on prior authorizations. What they did was they examined 178 people who had cancer, and they wanted to know what's the effect of prior authorization on cancer patients. It was a cross-sectional study. What it showed was that the majority of them had delays of at least 2 weeks or more to get treatment. It also increased patient anxiety and increased an administrative burden on patients. Patients actually had to do work to make sure that they could get treated. The prior authorization process was rated as bad to horrible by most of the respondents, and it significantly decreased their trust in the healthcare system. This study actually suggests not doing that. It said that prior authorizations for cancer care can have a discrete negative association with outcomes for patients. Streamlining the process is the key to optimizing the quality of care that doctors deliver and improving the patient experience with cancer care. Let me give you some of the data that they collected. Of the 178 patients, 69% of them, 123, experienced a delay in care. 90 of those with delays were for more than 2 weeks. 119 patients had to be personally involved in trying to resolve the issue with the insurance company. That means they're on the phone or whatever trying to get treatment, even though they've got cancer, and the insurance company doesn't want to give it to them. 35 of those people spent 11 or more hours on the phone trying to be involved. 148 of them out of the 178 said they don't trust the healthcare system. And here's the worst part. 22% of the patients were never able to receive care to treat their cancer. Okay, here's another one. I know in our newsletter and in these videos, we present a lot of statistical reviews of data describing the healthcare situation in the U.S. And you know, it's easy to kind of gloss over numbers. Sometimes they become hard to comprehend, and there's tragedy usually behind those numbers. A friend of mine here in Washington State sent me a particularly tragic situation. In Port Townsend, a dear friend of hers recently lost her husband to cancer, and here's their story. They had health insurance with a commercial company. It was actually a Medicare Advantage company. He needed to be admitted to the hospital for treatment. His doctor said so. Instead of covering the admittance to the hospital, this commercial Medicare Advantage plan only covered observation. It resulted in more than $10,000 in bills. And it also screwed over the Jefferson Healthcare Company, which was providing excellent care for him, because they didn't get what they should have gotten for treating him. This episode repeated at least once a month for the last 6 months of his life. That gives you a minor look into the hell that these people were going through. Not only did she lose her husband, she also got to lose about half of her savings, her life savings, paying for things that insurance was supposed to cover but wouldn't. So now she's a grief-stricken widow, and there's just no fight left in her to pick up and go after the insurance company. So we need to do this. Here's an action we can all take, and I recommend we do this. I want you to share any and all of these stories with your member of Congress and with your senators. It is easy to pass the buck on healthcare when democracy is in the balance, but people are dying, and this is something that they can fix. You can find their contact information in the newsletter in the resources section. I've also included a RESISTBOT text below you can use as a sample script. If you like using RESISTBOT, all you have to do is on your cell phone, send a text message to 50409, And the message is sign, SIGN, POVJZV. And here's the email you'll send. I'll read it to you. I'm your constituent, and I want to bring to your attention the abominable state of health insurance companies delaying and denying claims and denying treatment with prior authorizations. People die from these delays, and no one is held accountable. Here are some examples for you. A Journal of the American Medical Association study found of 178 cancer patients, 22% never received needed treatment because their insurance companies denied it. And there's a link to the study that's in the email, so your representative can read it. There's an article that was published this week by NBC on how Medicare Advantage, that's commercial insurance, is declining to pay for medically necessary treatments, what the doctor orders, in order to increase profits, and how this happens to damage rural health care. It actually damages everybody's health care. Link to the story is in the email. You can look at it as well. I just learned of a woman in Port Townsend, Washington, whose cancer-stricken husband was denied medically ordered hospital admittance for treatment. The insurance company refused to pay, and his wife was left with $10,000 in bills. This happened once a month for the next 6 months. He died, and in addition to losing her husband, half her life savings is gone. Now is the time to get on the right side of healthcare. For the sake of all of us, please stop siding with profit-minded insurance companies. I recall that all the GOP claims when Obamacare was coming in, that was going to lead to death panels and healthcare rationing. Well, guess what? That role is fully played out by the insurance companies, who are standing between people and their healthcare. Because of whether we live in rural or urban areas, we all want to see a doctor at a local hospital, and we want to be able to see that doctor and not be denied. We all want our local hospital to be open. No one, rural or urban, wants some corporate insurance giant located somewhere else in the country telling them that you don't need this test or you don't need that procedure and denying coverage and care. We need, a complete overhaul of the healthcare system. Widows who watch their spouses die should not watch their bank accounts be depleted for corporate profits. I believe universal health care, like HR 3421, public insurance paying private providers, is a step in that right direction. If you, as my representatives in Congress, have a better idea, bring it forward, because the greed in the system is killing us. Please stand on the right side of history on this one. I need to know what you plan to do, and I expect a response from you. That's today's message. I'm going to list the action out as well in the description box. Please send it. Thank you. Like, share, subscribe. Subscribe to Healthcare Advocacy's newsletter and get these in your inbox, the text of these in your inbox every day. Have a good evening.